Here, I'm going to talk about some common sign and symptom for Nclex PN and Nclex RN board exam. So the first disease, pulmonary tuberculosis. So pulmonary tuberculosis means the TB in lung, Mycobacteria tuberculi, organism name. The most common sign here, patient have a low-grade fever. Usually fever come after evening, afternoon fever. Patient also complain cough and weight loss. Pneumonia, lung infection, most common in extremely young or extremely old person. Means infant and older person, pneumonia is more common and danger. The cardinal sign, rust color sputum. Asthma. In case of asthma, we found the wheezing on expiration. So if anybody have a wheezing, first we will think about the bronchial asthma. Emphysema, patient give a history, or if you examine your patient, you can say the barrel-shaped chest is more common. They have emphysema. If patient has a Kawasaki syndrome, usually present with the strawberry-like tongue. Pernicious anemia, because of vitamin B12 deficiency, patient develop red beefy tongue. In case of Down syndrome, it is chromosomal disease, genetic disorder, we found protruded tongue or dribbling of saliva. In case of cholera, rise watery stool. If patient develop malaria, so characteristics of fever, step ladder like fever with chills. So fever come and go. So if you take the temperature and represent the graphical presentation, you can see the step ladder like pattern. Typhoid fever, road spot in the abdomen. Dengue fever, patient complain fever, skin rash, headache, and positive Harman sign. In case of diphtheria, if we examine inside the oral cavity, we can see pseudomembrane formation. In case of measles, pop-like spot inside the buccal mucosa. Systemic lupus erythematosus, it is autoimmune disease. Characteristic feature is a butterfly rash over the tooth cheek. Leprosy, Mycobacterium leprae is an organism, and we can see leonine faces, thickening of the folded facial skin. Bulimia, we can see chip marking faces or parotid gland swelling. In case of appendicitis, means inflammation of appendix. If you check the abdomen, we found rebound tenderness at the McBurney's point. Also, Robson sign positive. So if you palpate the left lower quadrant, elicit the pain in the right lower quadrant. What next? Next here, in case of meningitis, means inflammation of meninges that is cover our brain. So if patient have a meningitis positive, we found Karnick sign and Bardinsky sign, Rudensky sign should be positive. Karnick sign means stiffness in the hamstring, causing the inability straightening of the leg when the hip is flexed. And Brudzinski sign, forced flexion of the neck, LC2, flexion on the hip. So usually Karnick sign, it is check the knee joint. Babinski sign, check the neck. In case of tetani, hypocalcemia. So if calcium level is go down, patient develop tetani, and we see the chopstick sign positive or trouser sign positive. In case of tetanus, so if tetanus is, we say the rhizus sardonis or rectus grain. And pancreatitis means inflammation of pancreas. We found Collin sign positive or Turner sign positive. It indicates your patient have a pancreatitis. If patient have a pyloric stenosis, we found olive-like mass or patent ductus arteriosus. We found washing machine-like murmur. So if infant have a patent ductus arteriosus, we get a murmur, and it's called the machinery-like murmur. In case of Addison disease, like skin pigmentation. So everything is down, right? Hormone secretion from adrenal gland, steroid secretion should be down. In case of Cushing, the steroid hormone go up, U for up. So patient has a moon face appearance and also buffalo hum. In case of Graves' disease, hyperthyroidism, T3, T4 get up, but TSS go down. We found exophthalmos. Exophthalmos means bulging of the eye out of the orbit. Intussusception is GI problem. In case of pediatrics, we found the sausage-shaped mass. In case of multiple sclerosis, we can get a 3 characteristic feature is called Charcot triad, means nystagmus, intention tremor, and dysarthria. In case of myasthenia gravis, most important nature, we found descending muscle weakness or paralysis, and also ptosis. Ptosis means dropping of the eyelid, myasthenia gravis. Guillain-Barré syndrome, most common ascending muscle weakness. So here we are only talking about the most prominent sign and symptom, right? So if question come from this topic, they must give you most prominent sign, so you can easily get it. So if patient has a deep vein thrombosis, we found the Homan sign positive. In case of angina, right? So crushing chest pain or stabbing pain, and it is relieved because of nitroglycerin. Myocardial infarction. Patient has the same nature of pain, but not relieved by nitroglycerin. Stabling pain radiate to the left shoulder, neck, and left arm, and unrelieved by vasodilator like nitroglycerin. Parkinson disease, we found the pill rolling tremor. Tremor is important, and rigidity, also gait abnormalities. So cytomegalovirus, shortly called CMV, is more common if anybody is immunocompromised after organ transplant, HIV positive. So we see owl eye appearance of the cell, huge nucleus present. In case of glaucoma, we found that tunnel vision, increase the intraocular pressure in the eye. Retinal detachment, we found the flash of light, shadow with a curtain across the vision, characteristic nature in case of retinal detachment. What next? Next here, in case of Barger disease, we found intermittent claudication, mean pain at the buttock and legs from poor circulation. So when patient walk, pain start, and they take rest, pain disappear. It is called intermittent claudication. In case of diabetic ketoacidosis, we found acetone breath. So ketone body, acidic substance accumulate in the body, and fruity smell breathing. Pregnancy-induced hypertension, proteinuria, hypertension, and edema. Diabetic mellitus patient develop polydipsia, polyphagia, and polyuria. Gastrointestinal reflux disease, shortly called GERD, patient complain the heartburn. Hunspung's disease or toxic megacolon, we found the ribbon-like stool, pediatrics GI problem. In case of sexual transmitted infection, if STI causes herpes simplex type 2, patients complain painful vesicle on genitalia, painful. In case of genital warts, and warts 1 to 2 millimeter in diameter. Next, in case syphilis, painless chancre, chancroid, painful chancre. So it is the characteristics of ulcer. So you can easily identify, is it a patient give a history of sexual exposure within 2 weeks, and you see painless or painful chancre. In case of gonorrhea, green, creamy discharge and painful urination. So I mean the genital organ, vagina or penis, discharge the pus, which is creamy or green, right? And also give the exposure of sexual exposure history. Chlamydia, most common in United States, milky discharge and also painful urination. In case of candidiasis, white cheesy waterless vaginal discharge, and also trichomoniasis. We found yellow, itchy, frothy, and also foul smelling vaginal discharge. So here few disease and also most cardinal sign and symptoms for Nclex, for example.